chemical peels are invasive. This means that they are not just limited to the external surface of the skin, but they also exfoliate deeply, extending through the other layers of the skin. And while chemical peels are great for skin concerns like hyperpigmentation, acne scars, and wrinkles, they can be difficult for your skin. So in this video, I will go through what you can expect from your skin during your peeling process and how fast you should expect to heal. But keep in mind that all of this will vary from person to person. But before we go into what you should expect, we should discuss managing your expectations. Chemical peeling, though effective, is not pretty. It can look and feel quite uncomfortable. So my advice to you would be to trust the process and follow all of your doctor's instructions. Now let's talk about healing time. One of the most common questions that we get is, how long will my skin take to peel and heal? And honestly, we get it. It can be quite uncomfortable. However, there is no one answer to this question. It all depends on the kind and depth of peel you get and your skin itself. But with all that being said, we have come up with a general time frame based on the reviews and updates from hundreds of people who have done chemical peels, all with different skin types. So for light chemical peels, your skin is expected to take 1 to 7 days to peel and heal. Medium peels should take about 7 to 14 days, and deep peels should take about 14 to 21 days. Again, keep in mind that some people may heal faster or slower depending on how their skin reacts and their healing capabilities. Healing will also largely depend on how you would have prepared for your chemical peel and how you take care of your skin afterwards. You can check out our video on how to prepare for a chemical peel. Now we will talk about what to expect after different kinds of peels. So what should you expect after a light chemical peel? Light peels will be those that penetrate and exfoliate the top layer of skin. They do not go deeper, and the most commonly used one is glycolic acid. But you can also use lactic acid, malic acid, Jessner solution, and even salicylic acid. After you've had one of these solutions applied to your skin for a light chemical peel, you should expect redness, followed by scaling or peeling, which will last anywhere between 3 to 7 days. This will almost look and feel like a sunburn. Visible peeling and scaling may not always occur in some people, but in others, they may occur more than expected. This will depend on your skin type, your skin condition, and genetics. Depending on your skin, you may also have some irritation and itchiness, but this will be mild and supposedly easily controlled. To manage your symptoms, your doctor or skincare professional will most likely advise you to apply moisturizer and sunscreen. You will also need to avoid using makeup for 24 to 72 hours at least. In my opinion, the longer you avoid makeup and complicated skincare products during the process, the better. Your skin will thank you. Now, medium depth peels penetrate down to the middle layer of the skin or the dermis and will have a greater impact on exfoliation than a light peel. These will most likely use trichloroacetic acid or TCA in varying concentrations. They can also use salicylic acid and glycolic acid in stronger concentrations than light peels. Your doctor will advise and decide which ones are best for you. If you have a medium peel, you might experience redness, stinging, swelling, and flaking or peeling of the skin. Swelling will sometimes last for or worsen over 48 hours after the procedure. Blisters may develop and break open. Your skin will crust over and start peeling off within 7 to 14 days. Now, these sound scary, I know. But to manage your symptoms during the process, enlist the help of your doctor. As directed, you should perform daily soaks, apply ointments after each soak, and moisturize to avoid over-drying the skin. You should be careful to avoid direct sun exposure until your skin has healed, and remember to apply your SPF. If needed, your doctor may prescribe an antiviral medication for you to take for up to 14 days. You may wear makeup after 5 to 7 days, but this will depend on the condition of your skin during the peel, and it's best to consult your doctor first. Please remember that it's entirely normal for your skin to look rather angry before it begins to look like the fairy princess skin that you want. Now let's talk about deep peels. Here's the thing. Deep peels are not commonly used anymore. This is because they're very invasive and carry more risk of skin infections and complications. Healing and the entire peeling process can also be ghastly. Many professionals instead choose to recommend laser treatments for skin conditions that are deep within within the skin. However, some dermatologists may still do them, but keep in mind that these are so invasive and intense that you can only ever have one done in your entire life. Deep chemical peels are almost surgical procedures done using phenols, which are the strongest acids approved for cosmetic use, sedation, and local anesthesia. These need to be done by a certified and experienced dermatologist or dermatologic surgeon. Phenols penetrate down to the lowest layer of the skin and will result in a more intense reaction during the process and a longer healing time. Our next video will talk about how to care for your skin after chemical peels and the best cleansers, moisturizers, and sunscreens to use. So follow along for that. Here at Sassily Skin, we do our best to help you understand and take care of your skin. Help us to keep helping you by subscribing and hitting that notification bell. And remember that happiness is a habit, just like skincare.